today I'm going to talk about a few of the projects that I was able to present at ASH 2021. The first was a presentation looking at the combination of a TIM-3 inhibitor, Sabatolimab, and adding that to hypomethylating agents for patients who have high or very high risk MDS or who have AML. And so we looked at patients who were enrolled on combinations either with Decitabine or with Azacitidine and adding on this TIM-3 inhibitor, Sabatolimab, day 8 and 22. This combination is of interest because TIM-3 may have a number of roles in how both our immune system recognizes and responds to myeloid blasts or malignant cells, as well as it seems to play a role in how the leukemic progenitors themselves self-renew. And so there's this autocrine stimulatory loop where TIM-3 binds to galectin-9 and keeps itself, it kind of results in a self-renewal cycle for the leukemic blasts. We think that Sabatolimab may interact with both these interactions in the immune system. So by blocking TIM-3, it actually enhances immune recognition through NK or macrophages or T cells of leukemic progenitors. We also think that it may interact with that TIM-3 expressed on the cell surface as well, interrupting that self-renewal loop and resulting in leukemic progenitor death. And so in this study, we looked at a little over 100 patients who've been treated on these combinations, both with MDS and AML. It's a phase 1b study, so we found that we could combine the two. With any immunologic agent, you worry about immune-related toxicities. And there were some patients who experienced immune-related AEs, but overall they were manageable. People could be treated with steroids and resume therapy. And notably, they were distinct from some of the other checkpoint inhibitor toxicities that we've seen, perhaps with PD-1 or CTLA-4 inhibition. And so to that regard, TIM-3 seems like it's an agent that we can get into MDS patients. It's administered on days 8 and 22 or just on day 8 in the regimens that we used. And, early signals were encouraging that, we could give this drug effectively, and we saw response rates nearing 60% with a CR rate of around 20%, and a number of patients who were able to stay on drug for a long time with more durable responses. So some of the CRs, the median duration was about 17 months.